Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
Playing by Eye, Using Music as a Parallel to Clinical Oncology by Beatrice Preddy, MD. The Yamaha keyboard in our cancer center is strategically placed. It rests in the center of the tall, lofty atrium, an open space that allows sound to travel and echo, creating an echo one might expect from a concert hall or a large-capacity theater. From their position, keyboard players cannot fully appreciate the music they create. In the middle of the atrium, any sound is flat, shallow, and short-lived. But further away, and on the upper levels of the center, one can hear the music echo as the walls seem to vibrate with reflected sound. It is enough to pause one step to listen, perhaps recalling some half-buried memory or latent emotion a song elicits. But on center stage, beneath the street lamp-shaped light that feels all too much like a spotlight, the pressure is on. The keyboard faces half of the waiting room and the lobby Tim Hortons, which means as one plays, one can see reactions to the music, including winces when fingers slip. Faces turn solemn and reflective during slower songs. Patients, relatives, and healthcare workers alike dance and clap to faster-paced popular tunes. Feedback and commentary are steady about the music, the song choices, and of course, song requests. I find song requests challenging. A combination of performance anxiety and only moderate competence on the keyboard affects the quality of the music that can be produced on demand, yet does nothing to eliminate the desire to fulfill a patient's request. Indeed, the request is usually the simplest part. Do you know Bette Midler's The Rose? A simple tune, one of my mother's favorites, but I haven't played it in years, since high school actually, and the once familiar notes now elude me. But the empty space after a request lingers awkwardly, and the hopeful anticipation from the patient and their family squeezes my heart like a vice. To break the pressure, I test out a few chords. Dozens of pairs of eyes stare down at me from all over the building. My hands start to seize, to freeze. Panicking, I hit a note. Seems okay. Then another one. And a chord. That was supposed to be a chord. The eyes pin me down. I see disappointment. I hear whispers. They must be about me, that it's not as good as it sounded before, that I could do with some practice. I try again. Better. Another note. A broken chord. An octave. A melody emerges. Someone smiles, I think. Sweat soaks my shirt. Are we at the chorus yet? How much longer is there left in this song? Singing starts somewhere to my right, also a little out of tune, and it gives me the courage to continue on. Although the experience is nerve-wracking enough to make me dread song requests, despite the apparent joy they bring. The solution, once considered, seems simple. Practice playing by ear. It is impossible to predict who might be walking by on any particular day, but having the skills to reply to a request with at least a few bars of a beloved tune, thus brightening a face and a day, seems well worth the effort. Playing by ear, like most learnt skills, is more manageable when broken down into steps. The first step, or requirement really, is a general familiarity with the song and a plan for how to approach it. Fast or slow, block chords or broken, major or minor key. Once this is determined, one begins with the first verse. The first time is usually rocky and the mistakes are obvious, but with luck, a familiar melody starts to emerge by the chorus. The music grows louder with confidence. Engaging audience reactions helps musicians see how close they are to the target tune and where they need to adjust. Playing by ear, or perhaps playing by eye, as it is the reactions which truly guide the musician, is an amazing skill, one which interestingly spills into more domains than initially anticipated. After several ear practice sessions, I noticed a strange pattern in my clinics. The steps of a clinic encounter mirrored playing the song by ear. Prior to each encounter, I would consider the diagnosis and treatment plan, as well as a vague approach of how to handle the encounter, given the goal of the visit and the patient's journey thus far. Once inside the room, however, I began to alter this plan based on the patient's and family's responses, taking cues both verbally and non-verbally. Sometimes my words, tone, or gestures fell flat, and redirection was needed. Sometimes an unexpected reaction told me I just made a mistake, and I backtracked, trying again, paying closer attention to the reactions to ensure the second try was better. But gradually, we, usually, reached a steady state and managed to complete the visit on a strong note. Naturally, then, the next step would be to practice clinical encounters using these same steps, trying to take my clinical skills to the next level. Unlike a song, however, a clinic visit's stakes are higher, especially in the high-emotion field of oncology, and striking even a single mistimed chord could lead to disaster. I start small. Awareness. Noticing reactions I didn't before. There's the fullness in an eye before tears fall, the pallor of a clenched fist's knuckles, the subtle tremor of a shaking leg. I learn to call them out by name, ask about them, grief, frustration, fear. There is a pause, an empty space after such a direct question. A wide-eyed stare. My heart pounds awaiting the verdict. Was my diagnosis correct? A misjudgment breaks rapport, but accuracy is rewarded with surprise and opening up. Even family members look surprised as details are elicited that weren't before. There is no singing along. Cancer is not a beloved show tune. But as my skills grow, I find that not only are patients and families less tense during encounters, but I am as well. I develop faith in my skills to read the room and alter my direction based on what I see. And perhaps the biggest clue that one has succeeded, on both fronts, is the heartfelt thank you that follows the encounter. This parallel has made me realize that every interaction between two people, just like every song, has its own beat, its own melody. Is this fast or slow? Calm or anxious? Is this a happy exchange or a sad one? The dynamics of the encounter influence the melody, and a misstep or misplaced word, like a note, can lead to dissonance. However, by listening to the song of the encounter and adjusting as appropriate, an astute individual can actually improve the interaction, maximizing the potential of the encounter and allowing for a strong conclusion to the visit. It isn't easy work, to be sure, and sometimes the impact of the song can be hard to appreciate, especially within the confines of a four-walled clinic room. However, like the keyboard music in the atrium, the echoes resulting from one clinic encounter have the potential to reach far-reaching corners, echoing in ways previously unimagined and lingering far longer than when the song ends.
Hello and welcome to JCO's Cancer Stories, The Art of Oncology, which features essays and personal reflections from authors exploring their experience in the field of oncology. I'm your host, Dr. Lydia Shapira, Associate Editor for Art of Oncology and a Professor of Medicine at Stanford University. Today, we're joined by Dr. Beatrice Preti, Adjunct Professor at Western University in London, Ontario, in Canada. In this episode, we will be discussing her Art of Oncology article, Playing by Eye, Using Music as a Parallel to Clinical Oncology. At the time of this recording, our guest has no disclosures. Beatrice, welcome to our podcast and thank you for joining us.
Thank you, Lydia. It's a pleasure to be here.
So I usually start by asking our authors to tell me what they're reading, but in your case, I'd love to ask you a little bit about perhaps what you're listening to or your favorite musical pieces.
Yes, absolutely. Well, I do love music. I play 3 instruments myself. So I have several YouTube playlists that sort of as I hear a song, I'll add different ones to. So one of them is retro tunes like 80s, 70s hits that probably I know mostly from my parents. And then I have Broadway hits, musical hits, because I love musicals and singing. And then I have a random one that has a lot of Taylor Swift, much to the chagrin of my colleagues, because I will play that in the cancer center. Not around patients, but my colleagues.
That's lovely. Well, I think Taylor Swift is global phenomenon, is all I can tell you. Has music always been a part of your life?
Yes, yes, very much so. I think I started piano lessons formally when I was 7. Then I taught myself guitar as a teenager. And then once I hit medical residency, actually, my trick to myself was to start teaching myself violin. And I had the opportunity to take some lessons for a few years as well, which was absolutely lovely. But growing up, my mother loves music as well. She is Sarah Brightman, who is a singer who's British singer, and we used to have her playing, and my mother would sing. So I know all of Sarah Brightman's songs from the time I was a very early child, trying to pick those out on the piano as a young child as well.
So let's talk a little bit about how you bring that wonderful part of your life into your work as a physician and as an oncologist. Do you ever sing with or to patients? Do you talk about your love of music? Do you play music during your consultations? I'm curious all of a sudden.
Yes, absolutely. So I guess one way that I do bring it in is I have a little violin pin that I wear on the lapel of my white coat. It's a conversation point with many patients because the way I approach oncology is really try to bring in a human aspect and get to know patients, get to know what they like, who's at home with them, what are their lives like outside of the cancer center. And oftentimes people who are musically inclined will point to it. And it's a conversation starter, which can actually be quite relevant when we're starting about treatment decisions and such. And then having the opportunity as well to play and go down in a cancer center. And yeah, patients will sing and I will sing along with them as well.
So you speak of this with so much joy. Tell me a little bit about this piano that I imagine from your description located in the center of a large atrium in a cancer center, and people just walk by and informally connect with you and they ask you to play. When do you play and how long do you play and how did this start?
When I started off in oncology, I was extremely shy. I still am. And one of my mentors, who actually is a cellist, he plays the cello, found out about my musical inclinations and said, well, we need to get a piano in the cancer center lobby. Essentially, I can get Beatrice down there and start getting her more comfortable in front of groups, in front of people, in front of patients. That really, I think, was the rationale. But maybe on paper, it's more to have something nice for the patients to listen to. And he actually got a piano donated, or sorry, an electric keyboard donated to the cancer center. We did have a piano a number of years ago, but unfortunately it was too loud with the acoustics of the center, so we needed something with volume control. There's actually a little keyboard, a little black keyboard that's down there now. And the first time I played was probably 2.5 years ago now with my mentor, with the cello. I was very, very nervous. All these people are staring at you, and all these people are looking at you. And I actually had a bit of a meltdown just before. I thought, well, I can't do this. There's no way I can do this. But he coached me through it. And it was the first of many things that he coached me through related to oncology, relating to overcoming your fears to try and help other people. And that's really how that started. And eventually I got brave enough to go down and play on my own and chat with the people down there.
That's a beautiful story, both of service and of mentorship. And to see both of these things come together, as you say, your mentor probably had two things in mind: helping the community of patients that you serve and also helping you build confidence, as you say. So, talk a little bit about this confidence and this lovely metaphor in a way. You talk about finding the right tempo or finding the right music to play to please somebody or to help them relax, bring them joy. And then you draw some parallels to how you use communication in the consultation room, taking your cues from people and knowing perhaps when to slow down or when to change the tone or the voice. Talk a little bit about that. It's fascinating to me.
Well, I think one of the things I struggle with in oncology, and I certainly know I'm not the only one, is that sometimes you feel very helpless, right? Because we do have wonderful drugs, we have wonderful therapies. I'm a medical oncologist, so drug therapies, but they don't always work, right? And sometimes, despite your best efforts, despite the best that medicine has to offer, you feel very helpless and the outcome is not what you or the patient wants. So trying to find something that you can offer and that you can give that's more than just a treatment or more than just a drug. That's essentially giving up yourself. What can I as a person offer to a patient? And I guess superficially, the music itself is something that you can offer, right? To give people even just a few moments where they can escape the cancer center and they can listen to something. And when I'm down there, I'll play a lot of like all these tunes and these kind of things where maybe it triggers a memory that somebody might have of a time and place that's quite different than the one they're in right now. But also, it helps evoke that human aspect that I think we touched on earlier. And as you say, Lydia, and as I say in my piece about trying to match the tempo, trying to match the rhythm, because conversations also have tempos and rhythms. And human interactions have variations and they have moods. And it's also practice in a way, right? If you can connect to someone to music, perhaps you can connect to your words as well. Perhaps you can connect with your actions as well. Much the same sort of strategy.
And you bring up a very important point, I think, and that's to play, as you say, you start by saying ear, maybe no, by eye, because basically you're also
Mm.
taking in the visual cues that are coming from your audience. In this particular case, it's you're playing in the lobby, but in a consultation room from the patient and family and everybody who is there, and being very quick to take that into account and to redirect or make a change. And when you talk about that in the music, it's so easy to understand. And when you talk about that in the consultation room, that's such a skill, right? That's sort of where the art and the skill seem to go together. Can you say a little bit more about that or share with us some time or some anecdote where that really worked for you?
Honestly, I think the first thing that comes to mind is times when it didn't work. Sometimes, especially as maybe a more junior learner, you only realize that the patient encounter isn't going well when it's really not going well. You really miss those early cues that the patient is telling you, right, that they're in distress, that they're not happy with what they're hearing. And it was again with the same mentor observing me through several patient encounters and really deciphering it, saying, well, this is where, what did you think when they said this? And did you notice this look? And no, I didn't notice this look. Well, he did. And maybe you can pay more attention. And I think it was actually when I was playing music that I really started to make those connections because down there, I'm playing by eye. I'm trying to watch this patient or this person at the time. I don't know who they are to see, am I playing the tune that they want? And is it recognizable enough? Does it sound okay? Is it transporting them to that place where they're hoping to be? And then bringing that into the clinic room and saying, okay, this is actually working, right? I can look at this person and I can figure out how this is going and try and adjust or redirect to really try and make this encounter the most valuable it can be for them and help them get out from it what they need to get out.
So, Beatrice, what I'm hearing is an enormous sense of commitment to your patients. It's absolutely lovely. But I wonder if I can ask you a little bit about the flip side of that, and that is to reflect a little on perhaps how playing and sharing music reduces your stress or increases your sense of being well and being yourself and being more confident. Can you talk a little bit about that?
The bottom line is that when a patient encounter goes well, you also feel better because if it's not going well and people are upset, you will also be upset, right? So, again, very superficially, that's a good end goal to have.
That's right.
Music itself is very relaxing for me. Maybe when you're a small child and you have to play the exam pieces or you have to play what the teacher says or what your parents say, it's not quite as much fun trying to learn everything. But now I'm at the point where if I hear a song or I see a song, I'd like to play the song, I can just do it. So it's very, very lovely that way. Of course, I have all my instruments at home. So even if there's a song that perhaps is not cancer center appropriate, I can just play it at home. I hope the neighbors don't complain and it's fine. But it's really fantastic, especially singing. So being able to sing with two of my instruments, at least. I don't know. I'm sure there's violinists who sing. I'm not one of them. I don't have those skills. But with the other two, you just go down into the basement. I have a microphone. I have a sound system. And just get it all out. Get out all your frustrations, all the things that happened that day. It's very, very cathartic. It's a good release.
Over the years, we've had a few essays in Art of Oncology that talk about music and how important music is for that particular author. And it's just so lovely to hear. So I want to end by asking you a very simple question, and that is, what is the song that is most often requested these days?
Oh, that's hard. That's hard. It really depends who it is because I play to different generations. I have a rendition of Zombie by the Cranberries that a lot of people seem to like. Losing My Religion. But these days it's Flowers by Miley Cyrus, actually, I would say. Everybody seems to know that song.
Well, it makes me feel very old because I don't. I was hoping you would say something, something about these 70s, or I'll be more comfortable with 80s or with even with Taylor Swift, but I'll have to go listen now. So thank you. I want to give you the last word in the podcast. What is the central theme of your message as an author and as somebody who's sort of bringing this forward and putting this in front of the global community of oncologists? What can music give us?
Yes. Well, I think music and writing and words, which are a form of music in a way, they can help us remember, I think, the most important thing about oncology, which is the human aspect of it, right? We're dealing with people who are frustrated, scared, alone, lost, right? In some of the darkest points in their lives. And it's a privilege to be able to serve and help these people through their journeys. But that's not always with drugs and treatments. Sometimes that's just with what we do or what we say. And that's a gift, but it's also a skill that needs to be developed and remembered. And having music is one of the things I think that helps me do that.
It's absolutely beautiful. So thank you very much for the work you do and for sending us your essay.
Thank you.
And to our listeners, until next time, thank you for listening to JCO Cancer Stories, The Art of Oncology. Don't forget to give us a rating or review and be sure to subscribe so you never miss an episode. You can find all of the ASCO shows at asco.org/podcasts.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.